I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. I have with us a very exciting guest today, Melissa DiSipio. Welcome, Melissa.
Thank you, Craig.
So you and I have known each other for a little while, and I love the work that you do. Tell us about the work that you do.
Sure. So I am the director of a program unique to Pennsylvania. It's a healthcare quality unit, and it's called Philadelphia Coordinated Healthcare, or PCHC. We're one of 8 healthcare quality units around the state of Pennsylvania. We were the first. We were the pilot. We've been around over 30 years, almost 35 years next year. And we were started due to state institutions like Pennhurst closing in order to bridge the gap between providers, families, and individuals who needed access to community healthcare professionals like doctors or dentists, just like you or I.
So there's a nickname for those. They call them HICUs, right? So I'm just going to say HICU.
That's fine.
From here.
Yes.
So what does the HICU do on a daily basis?
So great question. So even though I have nurses on staff and behavioral health staff, like a licensed psychologist and behavioral health specialist, we do not provide direct care. We provide indirect service. So the most extreme cases in Philadelphia and the suburban counties will contact us, provider agencies. We provide education, a lot of training in person and online. You can find on our website, but also we'll provide consultation, record reviews, help when individuals are moving, maybe from a provider agency or from home or transitioning from a facility out into the community. We'll do statewide initiatives in conjunction with the Office of Developmental Program and similar to the other HICUs. But when someone has a complex medical condition like dysphasia or dementia or diabetes, or they're struggling with a behavioral health issue, they might contact the HICU and say, we need more services, we need more training, we need a consultant psychiatrist that we use to have a record review that the provider or the family are struggling with.
So what you mentioned training. So what type of training would you provide in, say, that example there?
Sure. So we have a long list, and you can go to our website, www.pchc.org.
What is it?
pchc.org.
Got it.
And all our training is free that we do virtually or in person for our constituents, for our providers and our families in the Southeast region. And then, of course, we had to convert virtually during the pandemic. Our online training is free on our website, and we do training for not only the provider agencies and nurses and staff, but also for individuals. But the training topics that you asked about, they're a massive array of physical health topics. So anything from, again, diabetes, aging. Most recently, Pennsylvania has started a Fatal 5 initiative, where they're looking at dysphagia and seizures and constipation and sepsis. And so they're dehydration, the whole gamut.
So the Fatal 5, yes. And we have the Fatal 5 Plus, so we throw in gastroesophageal reflux disease, and we commonly call them that. What's funny is if you look up Fatal 5, you're going to find things like some superhero stuff or some wrestling stuff. I see that all the time, but that's not what we're talking about. We're talking about the big preventable causes of illness and death in people with intellectual and developmental disabilities. Right,
because, our direct support professionals need a lot of training. There's a lot of turnover, there's staff turnover, there's support coordination turnover. It's very difficult right now getting nurses in our field, hiring RNs. So our nurses will go in and do a lot of the training for the physical health. And then, of course, there's the behavioral health side, which is just massive. And we, again, our licensed psychologists and our 2 behavioral health staff will do trauma training. There's always a request for trauma training, psychotropic medication training, anything to do with in the behavioral health sector. We'll do, they term it dual diagnosis, and we don't mean drug and alcohol training. We mean mental health and intellectual
I'm glad you
disabilities.
clarified that. I always have to do that as well too. When you hear dual diagnosis, you often think of substance abuse and mental health, but here we're talking about intellectual disability and a mental health condition.
Absolutely.
Yeah.
Correct.
So you mentioned that you provide training for support staff and training for individuals themselves, people with disabilities themselves. Are they done similarly, or are they different types of training, or how does it look?
We learned that if we do some low literacy training for individuals, the staff or the caregivers that take them get just as much out as it.
So kind of plain language.
Yeah, plain language, low literacy training. And so, we've done a whole array on the same health topics that we do for individuals and staff. Now we have higher literacy ones for the clinical staff and, maybe that second tier supervision type folks and supports coordinators. But, it's amazing when you're in a room full of individuals and the staff and you're talking about, them controlling their own diabetes or if they have high blood pressure.
Everybody learns something.
Yes.
Yeah.
They're my favorite trainings, and I always miss it when I go back and I get to sit in a room. And we used to do these sessions where we would have a men's health day or a women's health day or nutrition. They're the events I love the most and that I miss the most.
So you train mostly provider agency staff. Do you ever provide training to, say, clinicians out in the field to help them understand this field better, maybe local hospitals or emergency departments or anything like that?
Great question. We've done that over the years, and I've been there 24 years, so long time. But we have done some initiatives. We've done some outreach to hospitals. It's always finding that person that sees the value or maybe knows someone or has a family member.
A champion.
Finding a champion that sees the value in it. It ebbs and flows with the time. But right now we just got a request from Chester County because they see the need with their mental health clinicians. So, and again, it's working through the mental health side. So their community managed care organization. So they're requesting that our licensed psychologist, our director of mental health, do a training through them for their licensed psychologist.
So that has me really curious. Can you give me any specifics on what type of training they're looking for? I'm wondering if it's related to, say, understanding behaviors and how behavior might be a form of communication of some underlying health condition.
Yeah, that and how to increase like service and therapies for this population. Just saying, hey, this group really could access and benefit.
Use this.
Yeah, okay. And here's this underserved population that needs help.
Yeah. Well, we all need more training.
Yes.
For sure.
Yeah.
So, Melissa, we're coming to you today from the American Association on Intellectual and Developmental Disabilities Conference, and you play a little role in that organization, right?
Yeah.
So tell us about that.
So I started as a board member and then was previously secretary-treasurer, and currently I'm the vice president getting ready to take over the role as president-elect. And then I'm on the executive track to be president in a couple short years. So yes, next year I'll be planning the conference in Louisville, Kentucky. So,
all right.
Yeah, that's exciting. And it's definitely a value. I have learned and grown and been mentored by some iconic folks in this field, and have seen, healthcare and health promotion having a huge role and a place here, and been able to network and collaborate and learn a lot.
Yeah, you said iconic folks. You really do in this organization and at these conferences get to spend time with the leaders in this field.
Absolutely.
People who are on the cutting edge of research and really providing supports and services. And that networking is so key. If you're not a member and you're working, just join the organization and really take an active role in it. It's a great place to learn more about this field. And, I felt so alone early in my career. I felt like I was the only person who was doing this work as far as providing healthcare to people with significant disabilities. And then you hear about organizations and then you become a part of them, and you're like, I'm not alone. Thank you. And again, it speaks to the fact that we all need support. And I needed support to be able to do this better as well too. So
and you learn from each other, and you go to sessions and you network. And one of my first speaking engagements here was the opportunity to talk about the HICU model, the HICU role in integrated health, and the supports that we did, and that pretty much changed my role in the organization.
Yeah.
It's a great opportunity.
That's pretty cool. Yeah. Pretty cool. So what exciting things are you working on in your HICU right now?
Lots of things. Well, one cool thing is we have a role from the state, the statewide initiative, where we have a position, a family facilitator role, in which we are helping children with the most complex medical conditions move from facilities, long-term facilities, either out in the community, back home with life sharing or with providers. They're modeling it from a Every Child Texas, and we've been doing it for 3 years, and it's a social worker position, and she's done a remarkable job, moved over 30 kids in the last 3 years during COVID. And so... Yeah,
during COVID.
Yeah, and the state is... they're so pleased with it that ODP and OMAP is increasing the funding to increase the role statewide. So
excellent.
That's exciting. And then we're going to be actually increasing some positions and some supports and training to, again, support children, which we primarily over the past 30 years, we have been supporting adults with intellectual disabilities and autism, but helping children in skilled nursing that receive skilled nursing care.
So often when we say healthcare, we don't automatically think of dental care, but you have that as a focus too, right?
Yes.
And I think sometimes dental health needs are even more unmet than medical health needs. In some
absolutely.
cases.
We've kept dental at the forefront for a very long time. I think even before me, my predecessor was on the first statewide dental summit, and we've continued it again since PCHC has been around. We've worked with, the dental group for ODP and OMAP to make sure that access to quality dental care has been on the forefront, helping with working with the special needs units from the MCOs. And so PCHC has had a long history of working with the statewide dental groups and the special needs units to make sure that access to quality dental care has always been at the forefront for this population.
Excellent. So if people want to learn more about PCHC, tell us the website again.
Sure. It's www.pchc.org, and you can download any of the documents free or access our online training. And right now we have a lot of virtual trainings that people can access, and lots of presentations.
Even if you don't live in Pennsylvania.
Correct.
Right. Yeah. So it's available for everyone. So if you're looking for training options or want to get some ideas on what other people are doing, this would be a great place to look.
Yes, absolutely.
So Melissa, one of the things I do is something I call 3 in 3. It's 3 things in 3 minutes that you would like to tell the audience related, in this instance, let's keep it health specific, things that you think can improve health and wellness for people with intellectual and developmental disabilities.
Well, I think we need to do more outreach to the local medical community, both physical and dental, to increase professionals' access and education, so they know who we are and who we're treating. We also need to increase, student capacity, so outreach to the students. And I know we're doing a lot in Philadelphia, but we could always do more. So giving the students not only the education, but also the experience. So getting them out into the community, getting them out to provider agencies. We've provided internships at PCHC as a HICU.
Excellent.
So giving them, firsthand experience. And we've had remarkable experience with any of the students that have come through. So, more student mentorship. And then I guess is increasing the education for individuals themselves, letting them take control of their own health care and teaching them about their aging. They're not, they're living longer than ever before. And so they not only have their medical conditions, but, normal aging.
All of the things we all get to experience as we age.
So they need to take control of that and understand and learn from it. So, we've been a big proponent of that.
So education. Clinicians in practice, students, clinicians in training,
and then
people themselves.
Yep.
Yeah, it's great. I love it.
23.
I love it. Well, Alyssa, thank you so much, first, for taking the time to talk with me today, and secondly, and more importantly, for the amazing work that you're doing in this field.
You're welcome.
Keep it up.
I will. Love it. Love what I do.